A new way of treating colorectal cancer is helping some patients to avoid surgery.
Ultimately, for many, many years, the standard treatment for rectal cancer has always included surgery.
Dr. Sudha Amarnath is a radiation oncologist at the Cleveland Clinic.
And then everything else, including chemo and radiation, have kind of been added to surgery in order to improve outcomes for patients in the long term.
Newer research shows that patients who receive preoperative therapy do well.
Many patients who were getting preoperative therapy with chemo and radiation were actually having what we call a complete response to that therapy, which means that their tumor was completely disappearing. And ultimately, for those patients, we may be able to avoid surgery if their tumor completely disappears. So it's not necessarily a new thing, it's just that more recently there are trials that have looked at what happens if we actually omit the surgery piece if patients have a complete response to therapy. And the outcomes look very promising, which is great, especially for a lot of our patients who have very, very low tumors and would ultimately end up with a permanent colostomy if they had surgery. So it's something that's very exciting.
This type of treatment is not for everyone.
Typically what we're looking at are patients who have more locally advanced disease, who would already be candidates for chemotherapy and radiation. I think the biggest thing is really from a quality of life standpoint, the need for a permanent colostomy or even a temporary ileostomy for those patients who typically are undergoing colorectal surgery. And so, again, if we can avoid it in a subset of patients, we think that that's truly beneficial. But it really is limited to the subset of patients who have a complete response to this other therapy, and we otherwise still consider surgery to very much be the mainstay of treatment. If someone has a new diagnosis of rectal cancer, then we would want them to come in and have appointments with our whole team. So that includes typically a colorectal surgeon, a radiation oncologist, and a medical oncologist. They would also typically go through scans to make sure that we knew what the stage of their cancer was, and then if they were considered a patient who needed this additional treatment with chemo and radiation because it is a little bit more of an advanced tumor, then we would put them on the start of that paradigm of chemoradiation, like I said, and then chemo. And then once they got past that chemo phase, then it would be determined based off of their response to therapy whether they were a good candidate.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.